think there's a profound role, particularly for people who are operating in stressful spaces like residents, fellows, medical students, stressful lives, that music is helpful in easing the symptoms of burnout.
Hello everyone and welcome back to Ripples Physician Wellbeing. It's our podcast from the Joe R. and Teresa Lozano Long School of Medicine at UT Health San Antonio. I am your co-host, Dr. Adriana Diurich, and I am joined by Dr. Veena Prasad, our other co-host.
Wonderful. It's exciting to be here for the season 4 Life Beyond Medicine, because there's so much out there other than medicine. So we are trying to combine creativity like music,
yes, dance, writing,
pottery, advocacy, which will help our physicians to be better in what they do and take care of themselves. Here I'm joined with my wonderful co-host, Dr. John Courant.
So I am so excited for beginning our new season and especially enthusiastic to introduce our guest today, Dr. Richard Kogan. And certainly the words interesting and accomplished are excellent descriptors for Dr. Kogan, who's a clinical professor of psychiatry at Weill Cornell Medical Center. He's an avid and accomplished concert pianist and also the artistic director for the Weill Cornell Music and Medicine program. And so excited to have him here today. And our discussion today is really going to focus on the intersection between medicine, creativity, and mental health. So with that, welcome, Dr. Kogan.
Hi, John. Thank you for having me on your show.
We're delighted to have you.
We're delighted to have you. It's such an honor. Dr. Kogan, please tell us a little bit about your music and medicine program at Cornell Medical Center. I know you've been the director for a long time.
Well, I'm the artistic director, but the chairman of the program is Dr. David Shapiro, who founded the program 15 years ago. He had this idea, he's a colleague of mine, a psychiatrist. He wanted to make Weill Cornell Medical Center the most musician-friendly medical center in the country. That was his ambition. Wow. And that's really been the focus of the program. It's been an attempt to accommodate, so many people, so many students who go to medical school had music as an important component of their lives before they went to medical school. In medical school, they found they got too busy to actually pursue any kind of music making. They would also occasionally get the message that in order to be a really good doctor, you have to focus exclusively on medicine, and you have to put aside frivolous activities like music and music making. I mean, this is something that we actually feel passionately about, that the notion of that actually being involved in music can make one a better doctor. Yes. That it doesn't diminish one's activity. So what we've tried to do is we've tried to actually accommodate the musical aspirations of the people who come into the medical center. So whatever people have wanted, there's some people who've said, I play this instrument, I would love to. What would really make me feel connected to music is to go to patients' bedsides and to play for them. So we've tried to allow that, or to kind of arrange that. Lots of students have thought, what would be really great is if we actually had a medical center orchestra. And so we've had that. And orchestra's really in some ways been wonderful in fostering social cohesion in the community. Yes. So whatever people have looked to do, we've tried to accommodate.
Oh, that is so wonderful. We have Dr. Sigurova, who is a pianist or, musician.
Well, and Spanish guitar. He's an accomplished.
And now Dr. Dasco. So we have some wonderful people. That's something that we can incorporate in our wellness program.
And it makes a lot of sense because having seen my daughters learning their musical instruments, it takes so much time and dedication and discipline, especially when you don't want to learn or you don't want to play or practice tonight, your violin. To actually have to do that, I think, works really well with the things that are required to be a good physician. So I saw it written that you said that understanding psychiatry has really informed your music. And so I wonder if the reverse is true, that understanding musical composition and the musicians that created those kind of informs you being a psychiatrist.
Very much so, I think. My immersion in music as a musician, I'm constantly focused, and it's not just me, all musicians, we're focused on communication, expression, listening. Listening is really important for musicians. And, these wind up being really important when I'm working with my patients as a psychiatrist. I got great education, psychiatry residency, did a fellowship in psychiatry, and continued to be educated learning about psychiatric diagnoses, psychopharmacologic treatments, etc. But this sorts of skills, kind of what is emphasized and thought about a lot in the arts world as a musician, winds being extremely relevant, I find, in my one-on-one interactions with patients as I'm trying to help them heal.
That is so nice to hear, because I see the same thing when we connect on a level of music. Many of our residents, or there's one who is who used to play, he was like a concert pianist, and we have guitar players, we have dancers. So when difficult moments, we connect with music and we say, tell me what is important, which music is good to you, and then they go on. And then their therapeutic relationship is already formed. So yes, it's so beautifully said. And you also mentioned in your work that psychological resilience is a skill that helps one overcome traumatic events. And music can really help us cultivate that resilience. And give us an example of a famous composer or and a performer. And on the same time, you also emphasize composing is an integral part of being a musician. So maybe talk about that a little bit.
Yeah, I saw on the subject of resilience, I've studied kind of the lives and minds of the great composers, and I picked the composers whose music has meant the most to me. Mm-hmm. And I tried to use some of my experience training as a psychiatrist to think, what was it? What can I understand about these individuals that allowed them to create these masterpieces? In many cases, they lived 100 plus years ago, but they still resonate emotionally for us today. And I've actually found that every single story, every single composer whose music has meant a lot to me, there is a story of overcoming adversity there. I mean, ultimately, a story of resilience. True. Resilience is the capacity to transcend obstacles or to kind of overcome adversity. And I mean, I can say every single one of them is, if you want me to pull out just a few examples, I'll pull out the example of Beethoven, for instance. Beethoven, listen, I mean, people know about Beethoven. He was in his late 20s when he started losing his capacity to hear. Deafness, becoming deaf is a hardship for anybody. For a musician, it is catastrophic. Totally. And when Beethoven, there's written documentation of this, when Beethoven started losing his hearing, he thought very seriously about suicide. He said, there's nothing to live for. This is what. But he decided, no, I'm going to overcome my suicidal impulses. I'm going to hold off on that until I've kind of fulfilled my destiny as an artist. I have to create everything that's inside me. And it's one of the most extraordinary stories, because deafness actually made Beethoven become a greater composer. I mean, part of what happened is that once he was kind of locked inside that silent world of his imagination, he was no longer hearing the music of his contemporaries. So he was less under the influence of prevailing traditions. And he actually began imagining, conjuring up sounds, forms that were different from anything that anybody had created up until that point. So you would think it's an amazing obstacle to no longer be able to hear. And he converted that into an advantage. And I think that's this kind of inspiring story I try to use as an inspiration for my own life. I, who am obviously so much less talented than Beethoven, and the patients that I work with, we all have obstacles, though. Yes. And if he could overcome that, I feel, we can all try to at least grapple with what we have to deal with.
It's so humbling to hear that, because many of our residents have overcome so many obstacles, and they're still working hard, and knowing that, there's awareness about this, how you can overcome obstacles. In spite of all these things, they're all thriving. So it's very nice to hear. And it's also very humbling to hear that from you.
Yeah, I've never heard that explanation quite that way. Is being able, not hearing the other prevailing music, enabled him to be almost increasingly more creative, and yeah, I think that's really amazing.
Yeah. Now, if he were born with congenital deafness, he would not have been able to be the composer that he was as a youngster. He heard music. He studied music. He actually was a student of Haydn, Franz Joseph Haydn, a great composer. And he learned from him. He absorbed Haydn's style. So that was the foundation that he had. And I'm sure if he retained his hearing, he would have continued to develop as a composer. But I think he developed in unimaginable ways because of the obstacle that was thrown in his path.
So Dr. Kogan, what do you see of the role of music and other creative arts for residents in training, especially, they're immersed in this incredibly stressful world of patient care and obtaining knowledge and skills, especially for someone who may not have been creative from the beginning, like already was an accomplished musician or artist or dancer. Do you see a role for them to begin to kind of develop some creative activities in their lives?
Oh, for sure. I mean, I think there's a profound role, particularly for people who are operating in stressful spaces like residents, fellows, medical students, stressful lives. Music is extremely important to them. I think music has capacity to improve mood, for example, to reduce anxiety. I think there's a fair amount of literature has accumulated that music is helpful in easing the symptoms of burnout. And by the way, a couple things. First of all, I think it's not. I know most about music. That's the world that I'm in. But this is true for all of the arts. I think dance. The sort of physical release, movement, etc. Dance, particularly potentially therapeutic for some. Writing can be valuable. Theater, theatrical, also the arts, art, painting, etc. So all of the arts. All of involvement in humanities. And I don't think this is restricted just to people who had some kind of expertise before, like Dr. Dasho, who's here at this medical center. Dr. Dasho is a music major in college. He's an accomplished saxophonist. I've actually found that for some people who were accomplished, like he is and was, I think for some of them it's actually frustrating to be in an area of, in order to have my expertise as a violinist, I have to practice 4 hours a day.
Right.
I can only find an hour now. So I'm inevitably worse. They're frustrated. I actually find that people who have no background can get at least as much sort of therapeutic impact by having some kind of musical exposure and involvement during their time as a sort of a resident or fellow.
Yes.
That is so interesting you said that, because it also teaches them adaptability to situation. If you can't do 1 hour, at least do it for 10 minutes practice.
Yes.
So this is a good tip that we can use when we are working. And for my own life, now I say, I can't practice 1 hour, maybe I'm going to practice 15 minutes. Thank you for that tip.
Yeah, for me, being able to spend an hour and just write poetry is a delight and very healing.
Yes.
So, very good.
That's great.
So, looking kind of through the lens of music and medicine, do you have a favorite composer or a favorite composition that kind of talks to you a little bit about, or inspires you in your daily work?
Yeah, I would say, as sort of alluded to before, every single one of the composers that I've looked at carefully inspires me. They all do, and if I have time now, I suppose I can come up with a couple of examples. One of my favorite stories, and I like telling the story of the great American composer George Gershwin, because he, as a youngster, was he would have been tagged, I've no doubt. He had all sorts of behavioral problems as a youngster. He was a terrible student. He couldn't sit still in the classroom. He was impulsive. He vandalized property, set fires. He would have, sort of put on perspective of a modern day psychiatrist, he definitely would have been given a diagnosis of conduct disorder, almost certainly been given a diagnosis of ADHD, attention deficit hyperactivity disorder, for sure, and might have been started on a psychostimulant medication. Now, these medications have helped a lot of people. They did not exist during his lifetime. His life was turned around when he went 10 or 11 years old. A little boy in his class gave a violin recital. He was actually outside in the schoolyard playing hooky, as he typically would do. But he heard the window of the school assembly was open. He was utterly transfixed by the sounds of the violin. He became mesmerized by the notion of music. He started taking piano lessons. He persuaded his parents to let him. Once he started, all of the bad behavior just dissolved. It all melted away. And I think music kind of organized his brain clearly in a way that nothing else could have. So it just helped organize him. So I find that this is one of the best, although it's not a unique story, of music's capacity to truly transform the lives of youngsters. And when you asked about pieces of music, I mean, a piece of music like Rhapsody in Blue, which everybody knows means so much to all of us, has brightened so many people's lives, would not have existed had he not been introduced to music. And I think about his story often when people at elementary school say, we have kind of a budget crunch. We're going to kind of remove our music education or arts programs. And you lose potential people
I think
like
it's
him.
tragic.
So true.
I think so.
Oh, so profound. Dr. Kogan, I know I have been listening to you for a long time. You have done such a fantastic job of educating all of us and general public about composers and their mental health. And in a way, John, I feel it's also fair to say that somehow this has also reduced stigma of mental health among,
Yes.
like for people saying that, oh, you can be creative even if you have mental health issues. So, and it's also said certain compositions or evoke certain moods for, in some compositions. And I know definitely in Indian music, ragas, for example, if they say Hamsadvani, it brings a very euphoric mood, and some of the ragas make you feel like, you're melancholic. So I was just thinking if I see a client using music is, what are your favorite compositions at this time? Or what are some things that come to your mind? Could that be used as some way of getting into their mind?
The issue, and thank you for mentioning the notion of destigmatization. That's actually, in some ways, what I actually feel most passionate about. When I first started studying these composers, it was striking to me. I knew almost nothing about them other than that they composed music that I loved. So I started reading their life stories, and I realized that with a lot of them, oh my God, their lives sound very much like the patients that I'm treating. And some of them had diagnosable mental illness. And I thought to myself, wait, this guy had, and at the time, I would say at the start of my career, it was probably more true than it is now. The notion of stigma surrounding mental illness. There was, I think there have been a number of people who've done some work trying to reduce the stigma on mental illness, because there are treatments that can be accessible to people, but if people feel, if mental illness is a stigma, I don't want to kind of point out that I have it. So what I felt I could contribute is, I said, oh my God, I've studied like Tchaikovsky, for instance, who clearly had suicidal depression, Schumann, clear case of bipolar disorder. I realized that these people, it's sort of perverse to stigmatize a group that includes members who made such contributions to society. And I mean, you mentioned about the notion of music and moods and ragas making people feel better. One thing that ragas, certain type induce certain types of mood and others. I've been really struck by how universal reaction to certain types of music is. People from very different cultures, if you play music that's been designated as funeral march music, or music that's joyous, this music, everybody, a huge group of people gathering together from very different cultures will kind of feel the same way. So there's something universal. I just mentioned Tchaikovsky. When America, July 4th celebrations, whenever there is something in July 4th, universally performed is Tchaikovsky's 1812 Overture. Now, why? July 4th is a celebration of America. Why are we picking a Russian? But because the reason is he's expressing the emotions that we want on that day better than anybody. And meanwhile, similarly, Rhapsody in Blue is performed everywhere. Europeans, people in Beethoven's Ninth Symphony is performed everywhere. Indian music, there's a universal quality to it. And I mean, Yvina, you also asked about the notion of sort of mental illness, mental health. What can we identify? I mean, I mentioned Schumann. He's an example of bipolar disorder. And by the way, I have to say parenthetically, it's really difficult doing psychiatric diagnoses on historical figures. I mean, it's hard enough with the living patients that we see. But, these people who wrote a lot, and they wrote a lot of letters, and sometimes you can make an inference. And what I found with him and with many of the patients that I treat who are bipolar, you see that during their depressive periods, they have trouble concentrating. So there's almost no productivity during that time. They can't create, really. Then during the manic periods, they're super productive. I mean, they almost can't stop. The increased energy, decreased need for sleep, sharpened imagination. Now, so you would say, so why don't they just stay in a kind of a manic or hypomanic state forever? The problem is it tends to be fairly unstable, and they cycle, and they often kind of splinter and degenerate into something. And occasionally you can see that in the music making, or writing, for
or
people
artwork.
Or artwork, exactly.
Yes.
It becomes less sort of organized in a certain type of way. So yes, one can catch certain diagnostic clues occasionally from art. But then I think we also have to remember that art is a product of imagination. So you don't have to be depressed to write sad music. And by the way, there are people who listen to sad music when they're feeling depressed because they want the kind of empathic connection. It helps them. There are other people who really use sad music to help make them feel better. So there are people for whom that's the go-to move when they're sad. They want to hear music that makes them happier.
One thing that's really neat that I loved was the idea of when people think that other people have mental illness, they view them as broken, and that they're obviously they're less than. And I loved your idea that these amazing individuals who had mental illness, depression or bipolar disease or schizophrenia, whatever, were still highly productive and created beautiful things. And I think that's a really nice message to be able to have, is that you can have these things and still be an amazing anesthesiologist or internist or pediatrician.
So, Dr. Kogan, we ask all our guests to leave us with a pebble at the end of every episode. And this is just an idea or a practice or something that we can incorporate in our daily lives, just to make our lives a little bit more easier to, savor everything in life. So what is your pebble for us today?
I think the pebble might be just something very simple, that music can make us feel better. And involvement in music and the arts can make people better doctors. Actually, it doesn't diminish from people's capacity to be effective physicians. It actually enhances it.
So incorporate music into your lives in whatever way.
In whatever way. As you said, if you only have a few minutes, that's better than nothing. In whatever way. But I think the type of way, if you listen to music, you're at the end of a stressful day, you go home, you listen to something that's really meaningful to you. I'm reluctant. I don't give anybody a playlist because everybody has their own association with music. So people should choose music that they like. So listening to music is great. I would say actually making music's even better, more potentially therapeutic. And I would say best of all, if you can make music with others, the kind of music making in groups, that is probably the sort of the social cohesion there. I would say that's the best of all.
Yes, so you gave us several pebbles: social cohesion, listening to music, composing music. So we'll try to incorporate as much as we can. Thank you so much. Such an honor to be here.
Well, thank you, and thank you for all that. I'm so impressed by your emphasis here on wellness. The notion of a course here, I think you told me about this, John, or you have a course on compassion for residents. Wow. I mean, I'll tell you, when I was a kind of a medical student resident, goes back a few decades, but I don't think there were any humanities and medicine programs anywhere. It seems like there are more and more over the country. That's a great trend. And I think the trend toward wellness, which Vina, you and John are clearly championing, that is so valuable. It would have been valuable back when I was trying to go through it, but I'm really glad that you're doing this work now.
Well, that's very kind of you to say, Richard. Thank you so much.
Ripple's Physicians Wellbeing is made possible by the Joe R. and Teresa Lozano Long School of Medicine Office for Graduate Medical Education. To contact us or learn more about the Wellness Home, visit gmewellness.utesca.edu.
This podcast is inspired by the Dalai Lama's powerful quote, "Just as ripples spread out when a single pebble is dropped into water, the actions of individuals can have far-reaching effects." We provide physicians with pebbles, tangible and actionable practices that can help make positive impacts in their personal and professional lives.